We will be using a measurement of body composition to assist in determining health risks, design exercise programs that will be specific to the needs of the client, and provide a baseline for evaluating goals. 7 site skin fold measurements are used to determine the amount of subcutaneous fat or fat located under the skin. This evaluation will not be recommended for clients who are extremely obese or extremely lean. The equipment we will be using is a washable marker and a Lange skin fold caliper. On the caliper, you will note that there is a handle, a lever, and the prongs, which will grasp the skin fold, making the dial move in the counterclockwise direction, indicating a measurement in millimeters.
The skinfold sites must be precisely located using anatomical landmarks, and the following procedures must be followed for the accurate determination of body composition. Take all measurements on the right side of the client's body. The client's skin should be dry and lotion-free. Do not take skinfold measurement immediately after exercise. Identify and mark all sites before measuring. Firmly grasp the skinfold, which is 2 layers of skin and subcutaneous fat, between the thumb and the index finger of your left hand, 1 centimeter above the site to be measured. To grasp the skinfold, place the thumb and index finger about 3 inches apart on a line that is perpendicular to the long axis of the skinfold. Pull the skinfold up and away from the body. Keep the fold elevated while you take the measure. Keep pinching the folds with your left hand throughout the entire measurement. Hold the caliper in your right hand with the dial facing up. Place the jaws of the calipers perpendicular to the folds 1 centimeter below the fingers and halfway between the crest and the base of the fold, and release all the pressure on the scissor grip while keeping the caliper perpendicular to the skinfold. Record the skinfold measurement to the nearest 0.5 millimeters 1 to 2 seconds after releasing the scissor grip. Take skinfold measures in rotational order to allow time for the skinfold to regain its normal thickness. Take a minimum of 2 measurements at each site. If duplicate measurements are not within 1 or 2 millimeters, retest this site. Calculate the average of each skinfold site using the client's measurements and validated skinfold equations, and this way percentage body fat can be estimated.
2 centimeters to the right side of the umbilicus. Your triceps, vertical fold on the posterior midline of the upper arm, halfway between the acromion and the olecranon processes, with the arm held freely to the side of the body. Next, you will measure the chest, diagonal fold, which is 1/2 of the distance between the anterior axillary line and the nipple. This will be for the men, or for the women, which is 1/3 of the distance between the anterior axillary line and the nipple. You will take the mid-axillary measurement, which is a vertical fold, on the mid-axillary line at the level of the xiphoid process of the sternum. An alternate method is a horizontal fold taken at the level of the xiphoid sternal border in the mid-axillary line. Next measurement will be subscapular, diagonal fold at a 45 degree angle, 1 to 2 centimeters below the inferior angle of the scapula. Suprailiac, which is a diagonal fold in line with the natural angle of the iliac crest, taken in the anterior axillary line immediately superior to the iliac crest. And the thigh, which will be a vertical fold on the anterior midline of the thigh, midway between the proximal border of the patella and the inguinal crease of the hip. So pretty much in the middle between your knee and your hip. The two equations being used for the skin fold equations are the 7-5 formula, which consists of the chest, mid-axillary, tricep, subscapular, abdominal, suprailiac, and thigh, which are different from men and women. For the men, it is body density equals 1.112 minus 0.00043,499, parentheses the sum of the 7 skin folds, plus 0.000005, parentheses sum of the skin folds squared, minus 0.00028826, parentheses age, 0.0046971 times the sum of the 7 skin folds, plus 0.000005 times the sum of the skin folds squared, minus 0.00012828 times age. And that will be the two formulas that we will use for this assessment.